Let me now turn my attention to Delhi. The capital city is going through its bout of trouble, capital city and the NCR region, I would say, and I'm not talking just about the terrible pollution levels there. My heart really goes out to those who have to breathe that air right now. It's the concern with the rise in COVID cases. It's one that cannot be ignored. Look at the pictures in the bazaars right now, and we're showing you some of those that have been available to us. Huge crowds thronging. Now, while that is a great thing for demand, it's a great thing for small and medium traders and shopkeepers who need to see those sales going up. It's leading to a worry that caution is being thrown to the winds, and the numbers are there to back it. If you look at the number of new cases, additional daily cases in Delhi, on 1st of November, it was about 5,000 cases, 5,664 to be precise. By the 11th of November, in just about 10 days, the new additional daily cases of COVID-19 have gone over 8,500. That's more than a 50% jump in 10 days. And why this is even more concerning is because the opposite is happening nationwide. The opposite is happening in major hotspots, including in Maharashtra, where the daily new active cases are either leveling off or they're reducing slightly. So what can be done, and is enough being done? Let me go across to Dr. Suneela Garg and Dr. Sanjeev Bagai for more on this. Welcome to the show to both of you. Dr. Bagai, let me just first get your thoughts on why we're seeing these spikes and what is the ground situation, because we're hearing reports of ICU beds running out, of hospitals getting overcrowded again.
Good evening. Just allow me a couple of minutes so that I just give you some very important and very latest and new scientific facts which are backing why the numbers are increasing, especially at this time of the year. The first point which I would like to make is it's a complete societal apathy and callousness, especially in the festive season where there is just overt overcrowding, which is going to be very detrimental towards the overall battle which we have fought for the last 8-9 months. This is going to cause the dreaded 3Ds, which is disease, deformity, and death. The first point is pollution. We know that Delhi is in an extremely vulnerable position as far as pollution is concerned. There's a recent study which has shown, especially PM 2.5, to cause oxidative alveolar stress. That means cell death in the lungs. And the global impact of this is 15%, but in Asia, including India, is 27% increased risk. The lower temperatures in winter and the relative change in humidity increases the COVID transmission by 19%. The particles remain, the viral particles remain suspended for a much longer duration of time, well across 20 feet and over 16 hours. Because of the winter, the people are more now trying to huddle indoors where there is overcrowding, and the attack rate as far as the transmission is concerned is almost 58%, even though the people may be asymptomatic carriers. The children, the vulnerable, because they are immuno-aging, that means the immunity is lower, and the comorbidities are all adding on a huge percentage in this. What is extremely important and surprising is that the young adults, which were earlier spared, have shown 100% increase in terms of positivity in the last 3 months, especially in the northern hemisphere where the winter is coming in. And what we have seen now is more than 76% of the overall COVID positives are below the age of 60, which was not the case in the earlier few months. We also know that the gene sequencing has been done now in the COVID as far as the protein of the virus is concerned, and there are certain mutations which have taken place. There are new receptors which have been isolated to show more transmission, almost 82% nasal transmission. So therefore, not wearing a mask, not taking care, going into crowded spaces is going to have a huge impact. This is the first winter of this dreaded pandemic which is entering in, when this is going to be not a twindemic, but it may actually be a triple whammy. 1 is pollution, 2 is COVID, 3 is the other respiratory infections, including H1N1, which we call as the seasonal influenza. So I think it's a matter of deep concern. I think we need a war-like approach to control this. We keep talking, it's become like a cliche that don't throw caution to the winds. But this is somewhere now we need to implement the law. We cannot have people like you're showing on the street, like
No,
on the.
no, absolutely. Dr. Garg, I want you to come in on this as well. I think Delhi has enough of those cliches. I mean, every year we talk about the pollution levels. We can't afford to let this become one more of those warnings that no one heeds. Let me hear from you. What do you think can be done and how bad the ground situation is in your experience?
Basically, there are three things I look at it. One is as we have opened up over a period of time, it is the human behavior. You see, it is something, it's a marriage season. It's also, basically the offices have opened up, the metros have opened up. But you look at the pictures which you have been showing in terms of what is the situation in different markets and all that, we can hardly see any space between the people. So that is one thing which is very important part which you have to consider. So, and no market, I think at right time, you see, this is where administration has to step in to make sure that people are wearing masks and they're coming in limited numbers. That is where otherwise we will have to go back to lockdown again. So that is where important role of administration is also there to make sure, because people and their behavior is something which has to be, kind of looked into very, very carefully. But at the same time, wherever there is a mass gathering, we have to make sure that there is a social distancing, there is masking, and do we have adequate sanitizers which are available. So these are some of the important things which are important thing to be taken into consideration. Second part which has already been brought out, you see, there is high amount of pollution, and the pollution and the pollutants are increasing every day, and more so, you see, particularly in this season, where not only they affect or they compromise the respiratory system of the individual, the people are more asthmatics and all, and they compromise also for the viral infections. So people who are getting these asthmatic attacks and all that, they are also more vulnerable to viral infections. The third part which is also important is all this is marriage season. We will see that so many cards are coming and all that, but no card ever will mention that you come with the mask. That is so very important thing which we have to make sure into consideration. When all of our politicians, they come and talk about different things, they talk about festive season and all that, simultaneously a message has to go that whenever you come for the rallies, whenever you come for any gatherings, is there any masking? The third part is that about isolation, testing and quarantine. We are all aware of the fact that particularly in Delhi, you see, we do have pockets of community transmission as well. And this thing is also compromised. Let's say, because when we say there is a community transmission, that means we cannot trace back the source. So that is where what is happening. So these are some of the important issues which need to be considered from the perspective of the individuals, from the perspective of the the administration people. And the third part is that we need to see that our healthcare providers and our so-called administrators are also equally involved into the decision making.
No, absolutely. Now, Dr. Bagai, the fact is that, we're speaking on the eve of the festive season kicking off. People want to go meet each other. They want to feel that sense of festivity, and that is also important. So, do you suggest that people don't step out at all? Or can they go and meet each other? Should they continue to wear masks for the duration of the meeting? What would you advise people to do?
Yeah, I think it's most important social, moral, and ethical question. We cannot make the risk of transmission of COVID-19 to zero. That's virtually impossible worldwide. Our aim is to minimize the risk, minimize the transmission, and there are two basic mantras in this. One is do not go out of the house unless until it's a really essential or an emergency situation. Believe me, even though I'm a Hindu and completely irreligious from the other point of view, festivals will come again next year and the year after next and so on. I don't think this is the time to go to visit people's houses or go to crowded market areas or do rampant shopping. And the second very important point is masking. Indoor, I'm repeating again, the indoor air transmission can be equally lethal as outdoor. Therefore, wearing a mask, early identification of the common signs is extremely important. What festivities as a season and Diwali as a festival will do is it will take our focus off the radar and we may throw caution to the winds. Like I mentioned in my first part of my talk, the young adults between the age group of 18 and 30 have shown a huge bulge increase of 100%. That's the crowd which is going to go out. That's the crowd which will be in restaurants, in parties. This is not a time for socializing. This is not a time for celebrating. This is a time to put a head down, remain on track, continue to give the message to everyone around you to keep a good distance and to wear a mask. Trust me, if people don't wear a mask, they are bound to contact COVID-19. It's not a good thing to get, even if it's a mild disease. There are ripple effects of repercussions for months and years later. It involves almost every organ, and now there is enough data to show that it's actually a trigger of an autoimmune disease. So be careful. Don't take this lightly. This is not a talk to scare people. This is a talk to tell the common person as a viewer, be careful. We will have enough times to celebrate next year. This is the time to tide over this crisis period. This has been a long time of 8 months of a lot of dedication, not only of the government, of the complete society. This is a time to collaborate together. We can celebrate Diwali from home.
Yeah. Celebrate Diwali from home, celebrate safely, but do celebrate. Let's bring some festive joy to the mood, even as our fantastic doctors give us such great advice. And I commend both of you and all the medical professionals out there watching. You truly have been COVID heroes. The fact is that people are going out and shopping. People are going out and buying things, which is also very crucial for the economy. We've been doing a series of ground reports here at ET Now to check the mood. Here is Priyanka Iyer's report on how consumer durables is the hot item in demand this festive season.
It is Diwali and it's the time for celebration and discounts, but the scare of coronavirus still looms large upon us. So does the worry about the economic slowdown. But people are still stepping out, they're shopping, they're upgrading their gadgets, they're making life at home easier by their purchases, also work from home easier through their purchases. Let's take a look at whether coronavirus is really stopping people from coming out and shopping.
Luckily for us, I think consumer durable industry, the Diwali sales has been reasonably good. And I can say this from the experience of how the Dussehra which went by in the Navratri, we saw a growth of around 2 to 3%.
So, talking specifically about electronics, if you can tell us, there was a lot of demand also because, people are using phones, people are using laptops, tablets. How much of a growth in sales you have seen, say, year on year as compared to last year's Diwali?
See, overall what we have seen in the Dussehra, we have seen a growth of 3 to 4%. And actually that growth could have been more also had there been no supply issue. But we are facing supply crunch. And if I take it category wise, laptops we have seen a growth of nearly 100%. Then you have televisions which we are seeing a growth of 15 to 20%. Then mobile is there. There again we are seeing a growth of 8 to 10% because mobile was a very high base structure. Then in appliances, we are seeing a tremendous growth in the kitchen appliances segment. Dishwashers have just hit the roof because there was no base at all. Then OTGs, microwave ovens, we had never seen any growth for so many years, and all of a sudden we are seeing a good growth happening because people are staying at home, they're cooking, making pizzas, burgers at home, so they need OTGs, they need microwaves. Even refrigerators, if you see, people are upgrading to larger refrigerators. In cities where there is space, they are also buying one additional refrigerator. So I think overall it's been a very good season for the consumer durable industry.
Right, so is it these numbers you're saying are in comparison to last Diwali?
Exactly. They all comparison year on year, Y on Y comparison.
So the supply issues that you're talking about, that means that the demand is there, but supply is the constraint that you're seeing. If that were not there, then what sort of a higher level of percentage-wise sales you would clock in, do you think? And also, how are you trying to solve these issues that are coming in the way of your stock and supply?
I think if the supply constraint would not have been there, consumer durable industry would have seen a growth of 25 to 30%, which it has never seen earlier.
came here to purchase a TV because it's been a long time in lockdown. We are using TV so much, me and my family, and we are a joint family actually. So we are planning to take a new TV. That's why I'm here.
We are taking precautions from our side also, and the government is also helping us to take precautions, and everything is going fine. So it's life, like the technology has been day-to-day life, so we have to step out anyway.